Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. Today we are announcing 4 new cases of COVID-19. 3 of the new cases are in Central Zone. They are all travel-related, including a university student who lives off campus. The 4th case is in the Northern Zone and is a close contact to a previously reported case. And yesterday, for the second time in a week, we reported 0 cases. This is something for all of you to be proud of, and Dr. Strang and I are especially grateful that we are continuing to see these signs. While the vaccine program continues to roll out, we now have clinics in every zone in the province, vaccinating frontline healthcare workers. We are also in 5 long-term care facilities this week, 3 of them in Metro and 2 in Cape Breton. We continue to administer the first shot of the vaccine to thousands of Nova Scotians. And if you've received your first shot or are in the process of receiving your first shot, we will have a second shot for you. We are holding back those second shots until we have a guaranteed supply. There have been concerns about the supply chain, and as the Pfizer plant in Belgium is temporarily shut down in order to build up its operation to increase supply. We continue to work with the federal government, and it is our hope that this temporary shutdown will not last long, and any supply issues will be resolved as soon as possible. I want to thank everyone involved in helping to distribute the vaccine. It is a very diverse vaccine rollout, and it has taken a lot of people to step up and support us, so I want to thank all of them. And I also want to thank you for your patience as we as a province continue to deal with COVID-19. Over to you, Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Today we are reporting 4 new cases of COVID-19, 1 in the Northern Zone who is a close contact of a known case, and 3 in Central Zone, all of which are related to travel outside of Atlantic Canada. They are all self-isolating as required. One of the cases in Central Zone is a post-secondary student who virtually attends 2 of our local universities. So since October 1st, there have been 472 cases of COVID in total in the second wave, and 450 of those are now considered resolved, which leaves us with 22 active cases across all 4 health zones. And fortunately, we still remain in a position where no one is in hospital. Our epidemiology continues to look promising with 0 cases yesterday. But today we are reporting 4 new cases, so we must continue our cautious, careful, and vigilant approach. I am happy to report that as of yesterday, the outbreak at Eden Valley Poultry processing plant in Berwick can be declared over. An outbreak ends officially once we have 2 incubation periods without any new cases. And for COVID, an incubation period is 14 days, so we've had to watch carefully for the last 28 days, and now we can say that outbreak is over. We had to take immediate action in December to break transmission of the virus at the plant and prevent spread into the community. And I know that it was a challenge for the workers, farmers, and other businesses that rely on this plant, and I want to thank all of them for their efforts. Your sacrifices protected your loved ones, your community, and your province. Yesterday, there was quite a complimentary article written by the Globe and Mail's editorial board about Nova Scotia's approach to COVID. To quote the article, Nova Scotia went hard and early and stayed vigilant, reaping long-term returns. To see the national media acknowledging Nova Scotia's vigilance and hard work is something that we should all celebrate. I know our epidemiology looks very different than so many other parts of Canada, and this is something every Nova Scotian should be proud of. What we have all been doing has been and continues to work. Everyone keeping each other safe a priority, follows the COVID precautions, and continues to respect required restrictions. We all need to keep doing this if we are to continue to remain one of the safest places while Wave 2 peaks all around us. I want to let people know about changes about our improvements in our information that we have available online. We have introduced a new dashboard with access to more data on COVID-19 cases, testing, and vaccines. You can still find the data, the usual data, on our coronavirus website, the way you've been able to do it since early in the beginning of this pandemic. And we'll continue to update our data website to provide a high-level overview of the number of new cases in the province, the number of active cases, the number of confirmed and resolved cases, and that's always broken down between wave 1 and wave 2, the number of new and total tests completed in the hospitalization data, and deaths, if we have them. But now, as in addition, on that existing data website where all that information is, there will also be a link that will direct you to the new dashboard. And on that dashboard, there will be a map that you can click on to explore each health zone and community health network, and it'll provide you with an overview of the data in each of those areas, including the number of active cases at a very local level. The dashboard will be updated every day, Monday through Friday. We do realize that this level of detail is more than some Nova Scotians want, and for those people, again, reminding them that our original and existing data site will still remain in place. It is not the dashboard is an addition and not a replacement to our existing data. But for those of you, and I know there's many out there who want more data, this now will give you a place to go to get more information and a better understanding of the data that we have. And we'll continue to update our numbers daily on our coronavirus website, and we'll continue to do our regular posting on social media and news releases. But I encourage people, if you're interested, to go onto our coronavirus website and take a look at that dashboard. I'm going to reiterate and summarize some of the information that was discussed at the technical briefing around vaccines earlier today. As of yesterday, we have administered 8,520 doses of COVID-19 vaccine, and this includes there's 2,215 people who have now received their second dose, so they have completed their COVID vaccine immunization. Another shipment of 5,850 doses will arrive later this week, and when it comes, it will bring the total amount of vaccine that we have received since December 15th to 28,850 doses. Last week, we received notice that Canada would experience a reduction in vaccine supply from Pfizer over January and February, and within the last hour or so, there's been further announcements from the federal government that there's been further reductions, temporary reductions in our supply from Pfizer that will affect how much we get over the next few weeks. So, what we were expecting was a reduction of 13,500 doses. That's going to be, we have to get the total numbers, but that'll be reduced even further. But however, we still, according to the federal government, this reduction is simply due to the Pfizer production plant in Europe is closing down a production line so they can switch to another production line, and that's all with the purpose of over time greatly increasing their capacity. So it's a bit of short-term pain for a long-term gain, and we are being continue to be told that any reduction we're getting for February will be added to our supply that we can expect in March. This isn't ideal, but we have planned for these types of scenarios, and I want to assure Nova Scotians that we are developing flexible processes. So all our vaccine delivery is built with the ability to handle both decreases or increases in vaccine supply, and we can do that simply by adjusting the amount of vaccine that goes to clinics and the scheduling of both immunizers and Nova Scotians coming to get immunized. But there's still good news on the vaccine front. Today we opened the first clinic in the northern zone at Colchester East Hants Health Centre in Truro. This means we now have a healthcare worker-based clinic operating in every health zone in the province. Since December, we've launched 4 healthcare worker clinics and 6 long-term care clinics as well. Over the next 90 days, we're going to be putting a greater focus on immunizing long-term care facilities, rehabilitation centers, adult residential centers, and Department of Community Service facilities. We recognize that people who, the dual risk factors of age and other health conditions, along with living in congregate settings, are our most vulnerable. And we've made a greater emphasis on immunizing people in these facilities as a key priority for us. We're also going to be prototyping different models of vaccine delivery as we continue to prepare for when we get robust vaccine supply. So we will be implementing 2 clinics for those in the people living in the community who are 80 years and older, and implementing prototype single clinics in a First Nations and an African Nova Scotian community. We will be working very closely with our First Nations and African Nova Scotian communities to ensure that we are offering the vaccine in a culturally responsive way, and they have a large role in informing how those clinics work, the communication to their communities, and who is identified in their communities as a priority, as their first priorities for immunization. We will also be prototyping pharmacy and primary health care clinics. And the first healthcare provider clinics will be in Halifax and Truro for Nova Scotians, as I said, who are 80 years of age or older. So using our MSI information, anybody in those age groups will receive a letter from MSI in the coming days with instructions about how to book their appointment. We are developing both online and knowing that, especially seniors, not everybody's comfortable using online, other forms of options for people to go and schedule their vaccine appointment. Doing all these prototype clinics, whether it's in different populations or whether it's different types of vaccine providers, doing them now will allow us to learn from each of these prototypes and put us in much further ahead, so we are prepared when we ultimately get robust vaccine supply. We've got all these different ways of distributing vaccine, different types of vaccine providers, and different models of community clinics. We're ready to stand those up across the province to be able to deliver a large amount of vaccine in a timely manner. I'm also pleased to be able to say that evolving and new information about the Pfizer vaccine shows that it can now be shipped when it's actually thawed under specific criteria. And this does give us more flexibility to transport, store, and administer this vaccine into long-term care facilities especially. It's one of the reasons we're able to put a greater emphasis and greater priority on long-term care facilities. Most of our vaccine is the Pfizer vaccine. We were relying mostly on the Moderna product for long-term care facilities, which was limiting our speed for long-term care. But now with the loosening of requirements for Pfizer, we can actually get in, use that vaccine in long-term care facilities. So that is good news. We are also working to increase our storage capacity for various types of vaccine across the province. So we're adding 3 more cold storage sites, one in Amherst, one in Antigonish, and one in Bridgewater. And that will bring the total number of cold storage sites to 9 across the province. And each of those cold storage sites, it has an ultra-low freezer for the Pfizer product, it has a regular freezer for the Moderna product, and it has appropriate fridge space for some of the other vaccines that we hope to be approved that only require refrigerator temperature. So we're setting up this network of cold storage sites to then be able to move vaccine to immunization locations in all parts of the province. You will be using these cold storage sites to set up the mass immunization clinics in communities that I talked about. We'll also be opening up healthcare worker clinics at the IWK Health Centre and the Yarmouth Regional Hospital as well. The Nova Scotia College of Nursing recently announced that they are issuing conditional licenses to retired nurses at no fee to immunize Nova Scotians against COVID-19. So I'm really pleased to hear that the uptake has already been high and that 125 nurses have very quickly relicensed, been able to be relicensed in only 6 days. And I really thank the nursing profession for their interest in helping our COVID response, and I want to acknowledge their efforts. Other healthcare profession regulators are also instituting or also have instituted rapid relicensing processes to bring retired clinicians back in the workforce to help with our COVID response, and that includes the College of Physicians and Surgeons. And I thank all those regulatory bodies for their willingness to be part of our collective effort. We continue to work with Doctors Nova Scotia, the Pharmacy Association of Nova Scotia, and the Nova Scotia College of Pharmacists to determine how their members can support vaccine rollout in the community. And they are key, they're playing a key role, as I said, we develop these prototype clinics for pharmacy-based or primary healthcare based clinics. But there will also be a need to staff the non-clinical side of our community clinics. Actually putting a needle in somebody's arm and getting the syringe ready is just one of many roles that we need to run a successful clinic. So we'll be looking at community volunteers to help us out for many of these other important functions in community clinics. So for both healthcare professions and those who are just lay people in the community who are interested in volunteering, they can now go to the Nova Scotia Health Authority website to register, and that's www.nshealth.ca/volunteer. And I was on there earlier today, and there's a place that you click on if you're a healthcare professional, and a place that you click on if you're not, and it'll walk you through a process about how you can register to put your name forward to be a volunteer. So I encourage people to do that, and as we roll out in the months ahead, we will be looking, we'll have lots of need for people with all sorts of skills to help us roll out this, as I've said earlier, the most complex healthcare intervention we've ever rolled out in this province. Moving on to testing, in the coming weeks, we'll be setting up pop-up testing in some of our university communities to increase access, along with the regular testing as the quarantine period for students returning from out of province ends. We still have lots of capacity and primary assessment centers across the province for people who have symptoms. So if you are feeling unwell, again, we ask you to go online, do the self-screening, and get direction on testing, and you can be directed to any one of the number of primary assessment centers. And even if you don't have symptoms, you can still go online and book a test. And this is most important for people who have a lot of interaction with other people, whether it's because of their job or because of social activity. And we're continuing our pop-up sites around the province. Because of the rapid test, they're only for people 16 years of age and older. But if you are 16 or above, you can get a rapid test at one of these pop-up sites with no appointment. There's a rotating schedule of these, so if you're interested, again, on the Nova Scotia Health Authority website, there's an ongoing schedule of the location and times in various communities of these pop-up sites. So I encourage people to do that. The test itself is quick, and you can get your results in a matter of minutes. Before closing today, I just want to mention that it's been brought to my attention, not for the first time, that people continue to be denied services or access to a business or for health care or any other kind of facility, depending on the region of the province that they're coming from. As long as our COVID risk remains low, there is no travel restriction within Nova Scotia, and nobody should be denied service or access because they just happen to come from one part of the province to another. We are working closely with the Nova Scotia Health Authority about who they are not allowing into their facilities, as we recognize that there needs to be a balancing the risk of introducing COVID-19 to healthcare facilities, but also the important need for people to visit loved ones who are in the hospital. And let me end up by talking a little bit about exposure notifications, because the two are linked. I think often people are seeing that there's an exposure notification in one part of the province, and they're interpreting that as therefore there's ongoing community risk, increased risk of community exposure in that part of the province. And then they see somebody traveling from that part of the province, and they go, well, I don't want you to come into my business, or I'm not going to give you health care. The purpose of the notifications is simply to advise people if they were in a place where they may have been exposed. The exposure notices do not label or blame. Just because there's an exposure notice does not mean that the location itself is a place of increased risk in that community. It simply means that there was a person with COVID at a specific date and time who was in that location. So please, that's the only purpose of exposure notifications. They're not to label facilities, locations, or label communities. And I would encourage, but I remind people, if they do see an exposure notification and they were at that potential exposure site, please look at the instructions carefully in the exposure notification. And mostly we're telling people to go get tested. Do that promptly. Keep yourself and your community safe. So in closing, I want to thank all Nova Scotians for their ongoing hard work, their patience as we continue to operate, keeping ourselves one of the safest places around, but that does require ongoing adherence to COVID protocols and the necessary restrictions. Premier.
Thank you, Dr. Strang. Before I turn it over, I too want to thank all those regulated health professions who are dealing and working with some of their colleagues who have been retired, giving them a path forward to come back and help us ensure that our vaccination program rolls out all across the province. It's very much appreciated. And I also want to say again to Nova Scotians, to build on what Dr. Strang said, if you've heard a business's name mentioned, they are doing all the appropriate steps to clean that business and open it back up. There's no greater risk of you contracting COVID-19 in that facility. So if you hear a name, understand that business is going through a difficult period of time at that moment, but please go out and support them. Again, they're local entrepreneurs in our communities who will be here long after COVID leaves, and will require them to be here to help us grow the economic future of our province. So thank you. Over to you, Chrissy.
Reminder, one question and one follow-up in the amount of time that we have for today. First question will go to CBC's Elizabeth Chu.
Thank you. Dr. Strang, can you comment on the impact of the 13,500 doses plus the reduction for January and February, and what impact that will have on getting the vaccine into the arms of Nova Scotians?
So it's simply that. It's that number, and that's a bigger number now, given the announcement earlier this afternoon. It simply means we have to slow things down. We only have so much vaccine available. So we'll continue to work through our clinics, through our priority groups who are coming to clinics, whether it's healthcare workers in hospitals, long-term care facilities for both staff and residents and designated caregivers. It just means the pace and the number of people we can do has to slow down. So, we can only do so much with the amount of vaccine we have. Once we get more vaccine, we will pick up our pace. We'll continue to focus on our priority groups until we get through all of those. I think the other piece is to remember that this is another signal that we still don't have long-term guarantees around vaccine supply. We keep saying that we will have limited amounts of vaccine, at least for the first 90 days, and that's why we have to stick with very tight priority groups. It's also why we're saying in Nova Scotia, because of our safe epidemiology, we have to stick very closely with holding back the second dose of vaccine. We can't stop doing that holdback until we get long-term security of vaccine supply. The last thing we want to do is have a number of people with one dose sitting waiting for their second dose of vaccine far beyond the recommended 21 or 28 days.
Go ahead with your follow-up, Elizabeth.
Thank you. Regarding long-term care facilities and prioritizing them, is there a list, or can you elaborate on how you prioritize which long-term care facility is next in line for a vaccination clinic, and who will be next?
So I'm not involved in the details of specific long-term care. We did start in the Halifax area, simply with the three were the biggest long-term care facilities in the province. We started in Cape Breton, knowing we needed to be up in Cape Breton, and again, we started with the two biggest long-term care facilities there. We'll continue to move that out. Some of it is matching up the amount of vaccine that we have available to the size of a facility. But we can, if you need it, we can get you much more details on specific timing and sequencing. But we did start with our very largest facilities.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Dr. Strang, regarding your call for volunteers to manage COVID vaccine clinics, I'm wondering why community members are being asked to do this work as opposed to hiring through the health authority for these positions. I understand the vaccine clinics are currently fully staffed. Are there concerns about being able to staff future vaccine clinics?
So if you understand that we're looking at a range of, there's certain jobs, if you will, or roles within a vaccination clinic that needs a healthcare professional. Drawing up vaccine, actually immunizing people. But there's lots of other jobs that are, whether it's managing the registration of people, helping people while they're waiting the mandatory time period after vaccination. We're building on this based on our experience with our pop-up clinics. There was significant buy-in from communities putting their hand up and saying, we want to come and help out in some way. I really think that Nova Scotians many Nova Scotians would be more than willing to come forward and say, I'm prepared to volunteer my time to help support and run a COVID immunization clinic in my community, because knowing by doing that they're contributing to their collective safety in that community. We've had a number of businesses come forward and say, how can we help you? How can we bring our skills in, whether it's human resources or administration, etc. So already lots of people are demonstrating that they're prepared, as we've done all along, to step up and help each other out. And so I don't think we need to build this all I don't think there's anything wrong with building this partly on a volunteer basis, and we're already getting lots and lots of people saying we'd like to contribute as volunteers.
Go ahead with your follow-up, Lindsay.
Thank you. With Pfizer announcing the halt of Canadian shipments this week, I'm wondering what Nova Scotia was expecting from Pfizer for this week.
I don't have that figure. I think we had a reduction of about, I'm not going to guess. We had some reduction in amount this week, a substantive reduction in the next couple of weeks ahead. I think that information was provided in the slide deck as part of the technical briefing.
Next question will go to Alicia Draus with Global. Alicia, are you there? Moving on to Nabal Snan with the Herald. Nabal, are you there? Just one moment, we might be having an issue with my mic. Moving on to Heidi with CTV.
Oh, sorry, it's actually in tabs with CTV.
Hey, sorry.
No worries.
My apologies.
Just wanted to check, Dr. Strang, when you say we were originally expecting a reduction of 13,500 doses in January and February, what I know you haven't gotten the latest numbers yet, but what can you give us a better ballpark of what we're looking at? How much of a reduction? Are we looking at 20,000 or more than that?
We'll get more. We're waiting to get more details. We may actually, part of the immunization team may actually be getting this as we speak, more detail from the federal government about specific numbers of allocation for Pfizer vaccine in the weeks ahead.
Go ahead with your follow-up.
Thank you. If we continue to hold back the second shot, and considering these delays with the Pfizer vaccine in January and February, realistically, how long is it until everyone in Nova Scotia who wants to be vaccinated is vaccinated? Does that push that September timeline later in the year?
So as long as we get or make up the short-term delay, make that up in March, we can catch that up. As I've said, we're developing vaccination models that we can scale up and scale down. And so if we're able to ramp back up in March, it'll put us back on track. If it's longer than that, then of course things start to get pushed out. But if it's short-term delay with a makeup of vaccine supply, we can catch up and still be on target for having every Nova Scotian, by September, being able to have an opportunity to get vaccinated.
My apologies for the confusion. I was operating from a outdated list. Back to John McPhee with the Chronicle Herald.
Thank you. Dr. Strang, could you clarify the situations in which people are being turned away from healthcare facilities because they're from a particular part of the province? Are people not getting treatment, or are you talking about people wanting to visit somebody and being turned away? Could you kind of clarify those situations?
Yeah, what we uncovered is that there are the Nova Scotia Health Authority. They say if there's an area of the province, and we go by the community health networks, that has been identified as having a community cluster. They say that people coming from that area of the community cluster can't go visit a relative or a family member in another hospital. So we had a number of examples that came to our attention of people who were from Halifax, were traveling to Cape Breton to visit a relative and weren't able to visit. So we're working with the health authority on that to find that what is the right balance, recognizing why they want to be careful about visitors, but at the same time understanding what exactly a community cluster definition means. It doesn't necessarily mean that there's ongoing circulation of virus in the community. As I said earlier, we always have to wait technically for that 28-day period before we can for instance, say that there's no longer a community cluster. So we're working to find a more reasonable approach with the health authority on this.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. We heard at the technical briefing that the COVID vaccine clinics at pharmacies and doctors' offices perhaps won't be as expensive as, say, the flu vaccine clinics that we're used to seeing. I believe it's related to the cold storage challenges. Can you talk about what their participation level will look like in terms of the doctors and the pharmacies? Do we know at this point?
Not all the details. That's why we're actually working out a prototype of a pharmacy-based clinic and how a pharmacy, could support that. Also, a primary healthcare type clinic. But we're not certainly in phase 2 envisioning that we would be giving out COVID vaccine to every single pharmacy, every single family doctor's offices. There's too much wastage around that. That may be possible as we get towards the end of the immunization program. So exactly what the pharmacy and the primary healthcare clinics looks like, that's the purpose of the prototypes, to test some things out and really try those out. But certainly they're based on having pharmacists play a primary role as immunizers, having primary healthcare providers, whether the physicians, family practice nurses, or other healthcare providers, play a primary role as immunizers in those type of settings.
Next question will go to Graham Benjamin with Global.
Hi, thank you. Question for Dr. Strang. It's been about 2 weeks since bars, restaurants, and indoor establishments opened. With case numbers remaining fairly low, are the restrictions expected to change anytime soon? I wanted to get an update there.
Yeah, so that's an active conversation. We're looking at that this week, knowing that the restrictions that are currently in place expire 11:59 p.m. On Sunday. So we'll have more to say on this on Friday. But I think I want to maybe create appropriate expectations. We need to continue to remain slow and cautious. And as I've said always, even when we start to reopen things, it'll be a slow, incremental reopening, not taking on more risk than we're comfortable with. Our slow, cautious approach has what has served us well for the last 10 months. We're not going to move off track on that just because we feel a little bit more comfortable now.
Next question will go to Mike Tutton with Canadian Press.
Good afternoon. The zero figure for next week coming from Pfizer nationally. Does that mean the 13,500 is going to increase by thousands, fewer doses if you have available, or hundreds? Some sense of it, if possible.
I don't have those numbers in front of me. We're just, this is breaking news. We'll get more information. We'll be able to talk certainly in more detail in the next few days about what we know now about what our vaccine supply, Pfizer and Moderna, will look like over the next few weeks.
Go ahead with your follow-up, Mike.
Maybe for the Premier as well here, is these sudden announcements of a drastic reduction from X number to zero, does it leave you a little unnerved about the process and how things are unfolding? Everybody knew that there's a reason for this, but just the suddenness of an announcement and so much less than hoped for all of a sudden.
I think there's two parts to that question. One is, I think when you look at the cause, so Pfizer has said it's because they're closing one of their production lines to make adjustments to increase production. So as Dr. Strang said in his remarks, that is short-term pain for what we believe will be long-term gain, and that the lack of shipment next week will be made up in whether it be the following month or in the next 6 months for sure. And to Nova Scotians, about what's happening here is the diversity of the vaccination sites that we have in our province. So we have capacity in every region of Nova Scotia. As Dr. Strang had mentioned in his remarks, we're dealing with doctors and pharmacists as well. Volunteers are stepping up to help us man a variety of options of delivering this vaccine. So why that's important is because when Pfizer starts ramping up or a new vaccine gets permitted by Health Canada, we have a system that can allow us to ramp up vaccinations very quickly across our province. I say this, I go back to the diversity of testing we had in the first round, and we had last October, November, December, where we started testing in different ways, whether it was a pop-up shelter, a fixed shelter, or this in variations of how we were doing the testing. That's what we're trying to build on the front end around vaccination. So my message to Nova Scotians, while the news may seem disappointing, rest assured that here we are looking for when that vaccination gets ramped up again, and we have a system that will allow us very quickly to distribute that across the province. And I think by the end of June, we will continue to vaccinate the number of people that we thought we would in December. So while none of us want to see the adjustments as being made by Pfizer, I think we need to put it in the context of a company that is trying to actually make a short-term slowdown to ramp up production for the future. And at the same time, to Nova Scotians, here we will have a distribution network, quite frankly, that I think will be the envy of the country.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. In the technical briefing today, I believe I understood that once we get into phase 3, the large-scale distribution, that the order of vaccination, I guess, will be done with further age, by the oldest going to the youngest. There's been discussion out in the community about, people with underlying conditions, more vulnerable people should probably move up in that progression. I'm thinking of myself. I'm 57. I'm healthy. Why should I get the vaccine before a 35-year-old who has, diabetes or asthma or something?
So we do understand those concerns, but we also have to understand that by far the biggest risk factor for severe disease, hospitalization, and death is age. Other health conditions factor in, but nowhere near the extent of age. So also knowing that as we do the planning, we really recognize that as we move into communities, basing it on age cohorts, it will actually allow us to move more quickly through the population and is the most efficient and fastest way to get all Nova Scotians access to vaccine. It's not, and even people who may who have an underlying health condition, who may be younger, they will be protected as more and more people around them are immunized as well. So we're really focused on age as the main way we prioritize. The other way we're looking at is where do we have vulnerable populations based on long-standing socioeconomic other factors, our First Nations, our African Nova Scotian communities. We also have vulnerable populations who are in congregate living settings like our shelters, like our correctional facilities that need to be put up there up front about how we make sure they get vaccinated as well. But I come back to that really this is about getting the opportunity for all Nova Scotians to get immunized in the most efficient, fastest way possible, and sticking with an age-based cohort approach as we get into community clinics will get us there.
Go ahead with your follow-up, Tim.
Yeah, again, this is phase 1 and phase 2 are described as learning periods as you learn how to distribute the vaccine around the province, set up the protocols and so forth. I'm just curious, has there been any failure? Has there been any waste or loss of product?
I'm not aware we had any substantive waste at all. We're being vigilant about, I think I've talked earlier about how we tested out before we went even to our first long-term care facility. We tested out the process without vaccine, sending the cooler, the packaging, everything, and the temperature monitor to make sure it held temperature, and it didn't, so we tweaked it so it would. So we are being extremely careful that we don't waste a single dose of this vaccine, either because of failure of temperature maintenance or it being delivered to somebody who's not in one of those priority groups. So I've not been brought to my attention at all that we've had any substantive wastage at all. It's a key priority for us, especially in this first phase, is no wastage.
Next question will go to Victoria Walton with the Coast.
Thanks. This question is about the recent university student who tested positive. I was just wondering, or I guess in general, about some university students who have come back this term, whether they booked a test because they had symptoms and what day of their isolation they were tested on. Was it their first test? Was it a second test? Because I know those tests aren't required this time, they're just recommended.
So all the cases we've had, I think, is with 12 cases, university students, I believe, is the number. They've all been students who have been required to quarantine. We're asking them to come forward and be immunized between day 6 or 8 of the 14-day quarantine. And we've had upwards, I think the numbers are between 3,500 to 4,000 students come back. Out of that, we've had 63% of them are tested. We've had 12 positives. And the reason they're coming, they're positive is not because of symptoms, is because they came forward and were tested as part of their quarantine protocol, like we're asking them to do. And in each circumstance, they have been isolating as required. I continue to be impressed, and I want to give kudos to the universities and the university students about how seriously they are taking the requirement around the 14-day isolation. Like everybody else, they're stepping up and doing the right thing because they know it's the way to keep themselves and their friends, their community safe. So thank you to this university students.
Go ahead with your follow-up, Victoria.
Thank you. Earlier in the technical briefing, we heard that healthcare workers are using an internal app to book their first, second appointments for their vaccine dose. I'm wondering if there will be something similar to that available to the public once we reach that stage, if the government is in talks about doing that.
As you heard at the briefing, we're developing a number of mechanisms to both letting people online, ways that they will be alerted when their age cohort, when they're eligible to get vaccinated. Ways we're working with the Can Immunize app to have that adopted, so people can use that to go and have an online booking appointment piece, and they can enter information into their Can Immunize app, which then gets shared electronically once they get to the clinic. The vaccination information gets uploaded after they've been vaccinated. And it goes back to so they have a record of their immunization as an individual. It also gets uploaded into our Panorama system, so we are creating a registry of COVID vaccination as well.
Next question will go to Mike Gorman with CBC.
Thanks. Dr. Strang, you mentioned the change in the ability to ship Pfizer given new information about the vaccine. I'm just wondering if you could elaborate on that a bit and what that change means in terms of the province's ability to deliver vaccine to various parts of Nova Scotia.
As I said, it just allows us, they've now said that we can actually ship, with very tight parameters, but we can now ship thawed product. And it doesn't have to be maintained in its ultra-frozen state. It makes it much more feasible for us, as I said, to get it out, use the Pfizer product to get out to long-term care facilities. Previously, we were having to hold the Pfizer product for use only at our cold storage sites in the associated hospital clinic. Now this is quite a game changer, because now we can actually, not just Moderna, and recognizing that, I think roughly 2/3 of our vaccine supply is Pfizer, we now have a much greater ability, much greater amounts of vaccine, which we can actually get out, ship to long-term care facilities and immunize. Once we go to a long-term care facility, it's everybody, staff, residents, designated caregivers. So that's why we're able to make we're making a big push, making a greater priority for long-term care facility immunization with this change in the allowances about how you can ship the Pfizer product.
Go ahead with your follow-up, Mike.
Dr. Strang, appreciating that vaccination schedules are limited by supply, in light of how many of our new cases continue to be travel from outside of Atlantic Canada, what are your thoughts about the need to get vaccines to folks like long-haul truckers or rotational workers, perhaps sooner than later?
So we're looking at that, but I think we have to understand that, we have a number of other measures in place. Quarantine, we're now testing rotational workers. We're close to be able to starting a testing project for truckers. We need to figure out where they fit in, but as I said earlier, the value of vaccine is getting as many people immunized as quickly as possible, starting with those who are at greatest risk of having severe disease. So I think that's the goal of the vaccine program. Immunize people based mostly on age. That'll allow us to immunize as many people as possible in the shortest time possible, using other measures like quarantine, testing, etc., to minimize the risk from travel-related exposures. But at some point, we do have to think about what role does vaccination play. However, we also have to remember that just because somebody's vaccinated, we don't yet have good data to say that if you're vaccinated, that you could not still be an asymptomatic spreader. So even if we immunized all the long-distance truck drivers, we're still going to have them with the usual protocols around testing. If we immunize rotational workers, they would still have to follow the modified quarantine. So vaccinating doesn't actually change what needs to be done to the steps that they need to do to minimize bringing virus into the province.
Next question will go to Alexandria Guy with The Signal.
Thank you. So considering they're not necessarily included in phase 1, I'm wondering if there will be an action plan created to have people who are in homeless shelters vaccinated during phase 2.
Well, as I said just earlier, that priority is along with age-based cohorts would be vulnerable populations, including those living in aggregate living situations, and one of those is shelters.
Go ahead with your follow-up.
Shelters will be up there on our list.
Go ahead with your follow-up, Alexandria.
Thank you. And so an action plan for that would potentially involve community organizations?
We've already having conversations with our community organizations that support people who are homeless around COVID protocols, around testing. When the time is right, we'll include in that discussions around immunization as well. This is one of the areas where potentially see using our mobile public health vans to go to a shelter and immunize.
That's all the time we have for questions today.
Thank you, Chrissy. I want to take a moment to thank all of you for the sacrifices you're making. Your commitment to following public health protocols, and it's working. We are managing to control the spread of the virus. There's been a lot said about our small province across the country, You should take a moment and feel proud because it is because of your hard work that we are being recognized. But we cannot become complacent. This virus, as we all know, wants us to let our guard down. I also want to thank you for your patience around the vaccine rollout. This is a complicated process that involves a lot of logistics and its dependence on a supply chain that we cannot control. Many of you have had lots of questions around it. We are doing our best to address your concerns, and we will continue to give you updates of the information as the program rolls out. We want you to continue to be patient, to continue to follow the protocols, and do what you do best. Be kind.